Right, Director of the Vaccines and Infectious Diseases Analytical Research Unit from Wits University, Professor Shabir Madhi, joins me now live to discuss these numbers. Professor, thank you very much for your time this evening. It's always good to speak to you. So we've seen a jump in the numbers reported last night. Interestingly enough, the Western Cape now has the most number of new cases. What can we attribute that jump nationally and in the Western Cape to?
Yes, so good evening. And as you correctly point out, much of the increase is being driven by the Western Cape. The main reason for that is Gauteng was about 3 to 4 weeks ahead of the curve with this particular resurgence compared to the Western Cape as well as KwaZulu-Natal. And obviously, as we went into level 4 restrictions, that did perhaps slow the rate of transmission of the virus across the country, but Gauteng had to some extent already peaked by the time we went into those level 4 restrictions, whereas the Western Cape hadn't. And what we're really seeing now is the Western Cape continuing to increase, and it will probably continue increasing for another week or two. And then beyond that, we'll still see increase in hospitalization for a further 2 weeks. So it doesn't come as too much of a surprise. It just seems to be the natural trajectory of the waves that we experience in South Africa, where it continues until a significant percentage of the population has been infected in a particular region before it starts going on a downward trajectory.
Many people had expected to see a jump in numbers coming out of KZN due to that unrest and looting. Are we still expecting to see that spike, or has the time period passed in which we would have seen a spike if it had been likely?
No, certainly not. I think what's happening in KZN, there's still significant disruptions when it comes to access in testing. So what we're seeing from KZN in terms of numbers is not really reflective of what's probably occurring in the province. And again, KZN was also behind the curve compared to Gauteng. So over the next 3 to 4 weeks, we're likely to see substantial increase in number of cases as well as number of hospitalizations and unfortunately death as well in KZN. So KZN is still far off from peaking with this particular resurgence.
Have we seen enough of a reaction in mitigating those numbers from KZN health officials? Do you think they have acknowledged the fact that they are likely to see a spike coming and that the necessary steps are being put in place?
Well, there hasn't been much about it in the media, which seems to be the only source of them communicating. And I think they would be really reckless if they don't prepare for the worst case scenario right now. They've probably got about 2 weeks to go before it really hits them. And they really need to be preparing right now to make sure that they've got adequate healthcare workers, adequate PPE, adequate oxygen, and everything else that goes behind needing to deal with an increase in hospitalization.
So let's talk about vaccinations. That's a hot topic. Apparently, unvaccinated people being admitted to hospital and ending up in ICUs are begging nurses to be vaccinated, unfortunately, by which point it's too late. How do we address vaccine hesitancy effectively?
Yeah, absolutely. The time you reach COVID is not, the time you develop COVID is not a time to be vaccinated. You need to do that well in advance. And in fact, that's one of the reasons why this particular resurgence has had a major impact on hospitalization and deaths in South Africa, because we were delayed with the rollout of COVID-19 vaccines. How do we convince people that are hesitant about vaccines? I think the central message is that there's no ulterior and sinister motive for getting people vaccinated. It's all about trying to save lives and prevent people from being hospitalized and ending up with sequelae of long COVID. So it's really just in the interest of the individual and in the interest of the public that everyone that is eligible to be vaccinated comes forward to be vaccinated immediately. The days of trying to rely on social media for information about the virtues or the risk of vaccination, unfortunately, those days are over. We are dealing with a crisis. We need to accept we're in a crisis. We need to behave as we're in a crisis mode. And we need to ensure that we get vaccinated as quickly as possible, and everyone that's close to us gets vaccinated as quickly as possible.
What risk do unvaccinated people pose to vaccinated people, to those who are unable to vaccinate due to serious conditions or ongoing treatment, and to society at large? Am I more susceptible, if I were unable to vaccinate, to be infected by someone who chose not to vaccinate, and would that be more serious as a result?
And it's not only about people that might have some absolute contraindication for which there isn't any at this point in time to be vaccinated, that those that choose to be unvaccinated pose a risk. Those that choose to be unvaccinated also pose a risk to those individuals that are vaccinated, but who unfortunately, because of underlying medical conditions, might not mount a good immune response to the vaccine. So they still remain somewhat susceptible to being infected with the virus and developing COVID-19. So if people choose to be unvaccinated, yes, everyone can make that choice, but you make that choice not at your own risk only, but also you're putting others that you come into contact with at risk, particularly if they've got underlying conditions that actually doesn't allow them to mount as good an immune response to the vaccines that we would like for them to do.
Professor, I want to unpack that a little bit more because, so my understanding is that if I'm vaccinated, and I am, thankfully I was able to go and get jabbed, being vaccinated, I'm still susceptible to getting COVID. So I might still get COVID. It might not just be as serious as it would have been if I had been unvaccinated. But do unvaccinated people transfer the disease easier than vaccinated people? Is that essentially what it breaks down to?
Absolutely, but it also depends on which variants we're looking at. So as an example, right now with the Delta variant, in fact, if you are vaccinated, as an example, the Pfizer vaccine, the chances of you being infected is much lower, and if you are infected, you would have a lower amount of virus that you shed, and you're less likely to pass that on, compared to someone that's completely unvaccinated. So to some extent, it depends on which variants are circulating. The Beta variant, as an example, unfortunately, vaccines won't work that well in protecting an individual from being infected, but it would work well in protecting someone from developing severe disease. Okay. But right now, where we are in South Africa and globally, where the Delta variant is very much dominating, these vaccines do actually reduce the risk of infection with the Delta variant, and it reduces the infectiousness of someone that becomes infected.
I want to look at the numbers now in terms of the percentages of age groups that are being vaccinated. We know that just over 7 million people in South Africa have been vaccinated to date. When the above 50s were allowed to go and vaccinate, they were allowed to do so earlier than initially predicted because there was inadequate response from those over 65. And medical professionals decided, well, we don't want vaccine doses to go unutilized. Let's open it for the over 50 age group so that those vaccine doses don't get wasted. Is there cause for concern that perhaps vaccine hesitancy in South Africa is at such a level that we won't achieve herd immunity?
Well, we're not going to achieve herd immunity even if we get 70% of the population vaccinated. And I think that's a discussion of its own. It's no longer about herd immunity, but learning how to live with the virus. And the way that we can learn to live with the virus is to ensure that people are protected, not against being infected, but rather against developing severe disease and dying of COVID-19. So it is a concern that right now, I think it's just about 60% of people above the age of 60 that have been vaccinated. The target was to have completed that by the end of June, and we're obviously lagging behind. There's a number of factors that are contributing to that. I don't think it's only about vaccine hesitancy. It's also about the systems not necessarily being geared to ensure that people can get easy access to the vaccines. And certainly, initially, when we were using the EVDS system as a prerequisite for people to be vaccinated, that was creating an obstacle. So we need to work out how best to get vaccines to the people rather than getting people to come to the vaccines. And one of the initiatives, as an example, in the Eastern Cape right now is basically to start vaccinating the elderly when they're coming to the SASSA pay points. So we really need to focus on how we ensure that people above the age of 40 especially are vaccinated and make it as accessible as possible, which is beginning to happen in many parts of the country now.
Well, thank you very much, as always, for your time and your valuable insights. Professor Shabir Madhi he's the Director of Vaccines and Infectious Diseases Analytical Research Unit from Wits University.